Welcome to Courtney on Health, heard on malcolmpresents.com and other websites, but you have to find that yourself. Anyway,
we'll start.
Take over.
I'll take over. So hi, Courtney, and hi, Malcolm, and a big welcome to our special guest today, Dr. Nicole Solomos, who Courtney will bring in a bit. So I will welcome you to Courtney on Health, which is a Zoomcast series about how to get through these lingering COVID times. And we hope we get beyond these times soon, with tips on nutrition and exercise given by Courtney Gravenese, registered dietitian with a Master of Science degree in nutrition and applied physiology. Courtney is an experienced nutritional and health consultant in the New York metro area, and now, of course, beyond into the world, and will help guide you on a path to wellness and health. So we're going to be focusing on health coaching and sports medicine. Health coaching is an important part of athletic training, whether it be on a professional or amateur level. There's a lot of high school and college sports, especially now in the beginning of the season. While there are many people participating in sports, there are equal amount of armchair quarterbacks, kind of like me in a way. It is important, though, for athletes to train to be healthy and prevent injuries. It is also important to get the armchair quarterbacks off their chairs to exercise. I originally had off their butts to exercise. Sports medicine is not just for the sports activist. It is also for the sports lover who dabbles in the game, whether you play for your office or town softball team, have a touch football game with friends, cheer on your team from a tailgate party, or watch various sports from the comfort of your home. Sports is an integral part of many people's lives. So play ball and enjoy and get out there if you can. And here are some, and root for your home teams. We're in the stretch of baseball. We're just starting football and other sports soon to follow. And everyone will have 4 television screens in their house going. So here are some quotes that kind of are apropos for the topic today. I'll start off with this. Exercise not only changes your body, it changes your mind, your attitude, your mood. And that's written by Anonymous. There was no name. When it comes to health and well-being, regular exercise is as bad as close to a magic potion as you can get. And that's Thich Nhat Hanh who said that. One of the great, he's an amazing philosopher, and he's just incredible person. This is my favorite. Life expectancy would grow by leaps and bounds if green vegetables smelled as good as bacon. You get a lot of, and this is for you, Dr. Nicole. And it'd be interesting to know who said this. The doctor of the future will give no medicine, but involve the patient in proper use of food, fresh air, and exercise. That was Thomas Edison said that.
Go figure, right?
That was pretty crazy.
Maxine, what if we cook green vegetables with bacon?
I don't know.
A little bit.
Well, you guys have to let us know the recipes for that.
All right.
And here's the last one. Exercise equals endorphins. Endorphins make you happy. That's by Anonymous. So let's all be happy. So Courtney, please introduce today's special guest.
Absolutely. Well, welcome, Dr. Solomos. She is a board-certified family, sports, and lifestyle medicine physician. She has years of experience with non-surgical sports medicine and orthopedic injuries and related ailments. She's also a certified health and wellness coach and is in certification for life coaching as well. Dr. Solomos is a member of the American Medical Society for Sports Medicine and the American College of Lifestyle Medicine. She was named one of the Castle Connolly top doctors in 2019, 2020, and this year, 2021. She enjoys working with recreational, amateur, and professional athletes so that they can remain active and participating in their endeavors. So what a great, great combination. We're so thrilled to have you. So welcome, Dr. Solomos to our show. I know we have limited time, bunch of questions, but maybe we can jump right into it and just maybe we can start with, for those of our listeners who might not really know sort of the meat of what sports medicine is. If you can help us out, but tell us a little bit about what sports medicine is and perhaps some of the more common injuries that you may see in your practice, either injuries or conditions that you might see.
Right. Thank you so much for having me. This is really exciting. And so I want to talk about what I do. I mean, sports medicine to me may be different than sports medicine to another physician that does it. But for me, since I've been out of my sports medicine fellowship, I have worked in the orthopedic setting. So I do work in an orthopedic practice with orthopedic surgeons, and there's one other non-surgical physician here. But for me, it has meant, in my professional life, sports medicine has meant that I deal with orthopedic injuries and ailments. And most of those are treated non-surgically. So there's certainly a huge role for me here in my orthopedic practice. I would say that I treat most commonly, I would say, knee problems, and actually most commonly in this practice, I treat osteoarthritis non-surgically. So, sports, people often think, oh, well, geez, it's only for young people that are participating in team sports or some type of school or organized sport, but that's totally untrue. I see people of all ages, and they may be participating in an activity by themselves on the weekend, from home, from, an amateur type or club sport, and people of all ages participate and unfortunately may have some sort of injury or ailment that results from that. So I deal with all ages, above 12 mostly, but and there's no limit to what sports medicine physicians can do related to the musculoskeletal system. I personally, as I said, I'm in an orthopedic practice, so I focus mostly on those musculoskeletal injuries and ailments. Would
you say that, and I'm imagining because life has shifted for people greatly over the last 20 months or so, working at home, their work environment, but even so, snapshot last 20 months and maybe a period that predates that, would you say that some of these conditions might be due to not necessarily a sports related injury, but a lifestyle habit? So inactivity, overtraining, poor work ergonomics, just the way people stand or sit on a daily basis, or even diet.
Oh, totally. I mean, so there has been a new phrase that has been coined, it seems, since the pandemic began, and that's pandemic 10 pounds, or, there's been a lot of that going on. So certainly I've seen that there are many more people that are home, and that may mean working out from home or working out less. Certainly, I think that people that are working from home have been more sedentary, because it seems that the workload has been somehow more as they're working from home. And just to bring something that just came to mind, teachers, when they were home last year, were definitely more sedentary than they usually are during the day, not walking from classroom to classroom. That's usually something that happens with me, my cat in front of the camera.
Yeah.
Sorry about that. I should have warned you, Dr. Solomos, that Simba likes to crash the show every
That's amazing. I love it.
I
have 2 cats. I make a lot of exercise videos that love to get in front.
Yeah.
So anyway.
I'm so sorry. Go ahead.
No, it's cool. I love it. So yeah, I mean, I don't know, now it seems that there are more people that are back to their outdoor activities. So we've had, you know, the school-aged kids coming in, and even adults who are back to their regular outdoor activities, whether that be with a team or on their own or whatever. So, but I would say the increased sitting and the decrease in getting up and walking around during their day has definitely affected people, as well as the pandemic weight gain.
Yeah.
Well, I find out that even though we're at home, I do as much exercise from the home as I did when pre-pandemic. And I think people who stay at home, they would have they wouldn't exercise anyway. They get into their car, go to work, sit in front of the desk, come home, take the elevators, take the escalators up instead of walking. So I'm not quite sure where the overweight might be, because you're near your refrigerator.
Closer to the fridge, yeah.
It's always tempting to go and get something to eat, bite to eat. But I think generally the out of condition and the overweight is a factor that's affecting at least the American public, because we're not. There was a book I was reading by Keep Sharp by Sanjay Gupta. And the number one thing for him, both mentally and physically, was exercise.
Right.
Yeah.
That makes sense, because, and also I find having a dog, a pet, makes me get out there and walk a lot more. I mean, I walked before. And also when you had your arm up like this before, Doc, you had your watch. I don't know if it's an iWatch or a Fitbit. And a lot of people seem to be relying on this as a tool. And I'm wondering if people in your practice say that, because I know how much I'm exercising. I know, and sleep. I mean, is this something that you see in your practice more? I'm just curious.
Is what are you asking, if I'm seeing more?
I'm asking if people have said anything about it, or you say anything about, check your watch, look at your metrics, look at how you walk. Are you walking X amount?
Yes.
Are you sleeping X amount? Are you using this as a tool? Or can you say to them, hey, I see you wearing this. Are you using it? Is it something that can help?
Right. It's interesting that you say that, because I don't always, I think unless the patient brings it up, I don't necessarily ask them about their watch, or, how they, but I wanted to get back to the being at home and whether people are exercising. I mean, the only thing that I have to say with regards to what Malcolm said about they probably wouldn't be exercising anyway, is that the people that are home that did go to the gym outside of their house, some of them are intimidated and they don't know what to do when they're home. They may feel that they don't have the equipment. And I think that there's been a huge role, and there still is a huge void to fill, which I think Courtney has filled. And there are many people that have filled, but with these videos teaching people how to exercise, and there may be populations of people who just don't even know that they don't need equipment to work out. You can go outside and take a walk, or even if you want to stay inside, there are so many things that you can do with minimal or no equipment. And I think that that is one way that we have grown this year, year and a half, and that we're still growing, is that, people can access instructional, educational videos about physical activity from their home, and learn new ways, and realize that they can do it without having gym equipment or an instructor in front of them physically. So that's something that I think has emerged and is still emerging and helping.
You know what I find is totally neglected, and again, I've been exercising for over 50 years, is the alignment of the body. It seems like when you hurt yourself or something happens, if you either go to a chiropractor or a doctor such as yourself. It's the alignment of how you're walking, how you're stepping. Are you wearing the right shoes? Is one foot, and I know like one foot is generally larger than the other foot, you know, like it's like a half a size. Are you stepping right? Or is your hips right? Or your shoulders right? Because you do one thing wrong, it throws off your whole alignment, which causes aches and pains. And no one really ever talks about it. I go to my general practitioner. He makes sure I don't have any disease.
Yeah.
But he's not looking whether I'm, you know, my whole body composition.
Yeah, I mean, so when you say that, something that comes to mind that I do, I think frequently, is that I tell people simple postural exercises they can do. I do notice when somebody, either because of age and having some arthritis in their spine, or some people just have bad posture. And I think that contributes a lot to whatever ailment they're here for. And it may be that it contributes just to some different ailment, but I commonly give people very simple exercises that they can do to cause themselves to be aware of their alignment and their posture in particular, or and help them with that. Because I am, and this has been a little bit controversial lately, but I am a DO also. So I went to osteopathic medical school, and we focus, besides all of the general medical information and education that we have, we also focus heavily on the musculoskeletal system. So I do feel that DOs are primed for this type of education to give to their patients, and we have a lot of experience treating the musculoskeletal system, in addition to all of the medical education that we receive. So that's one way that I use my osteopathic background, is to really teach people just simple things that they can do to improve, as you said, the alignment or posture.
Yeah, I think it's a message that needs to get out, because first, just we sit way more, and I'm sure Dr. Solomos, you see this, and maybe a lot of your patient base, we sit as Americans way more than the human body is designed to sit. So that type of message that comes out from you and colleagues and your colleagues is an important one. I just think it's very misunderstood and it gets overlooked. And I know when I'm always working with a client, it's like, you got to get up like every 90 minutes. If you're sitting in your chair, I don't care what you have available to you, get up and walk around. Those breaks, don't cross your legs. I mean, things like that people just habitually do. So such an important message that you're getting out there. And I know that health and life coaching has become very, very popular and is viewed as an extremely, and in my opinion, as it should be, very important tool in affecting positive behavior change. So can you explain what a health coach does and how it might differ from a counselor? Because I know counselors are more prescriptive in nature, like, giving sort of a plan, but my understanding is that health coaches really define more of, meeting a client's needs, like helping them develop their own personal goals, like where they are and their level of readiness.
Exactly. You took the words out of my mouth. I mean, I think the biggest difference between a counselor or a therapist, I mean, first of all, a coach, no matter what your other role in life is, like for me, a physician, we're never giving medical advice. As a coach, when you're in the coaching role, you're really meeting the patient where they are and showing them their brain and how it may be working against them, and just showing them their power. We don't, as coaches, we don't give somebody a protocol to follow. It's their own protocol. We help show them that they have the power to choose how to think about things and really make their own protocol. Yes, we will guide them when it's necessary, but we, in general, especially life coaches, I think health and wellness, there is a little bit more guidance and advice, but certainly as a life coach, you're not giving advice. You're really saving space for a client you are showing them their brain and really just showing them that they have the power to choose how they think, which ultimately creates their result. Health and wellness, like I said, really, again, we're just a guide, and we're just there to help empower a client.
Well, you're almost talking almost like a psychotherapist, because I mean, that's not it, but that's what, when, and I've been to therapy, and that's what they do. They say, okay, you have the power to do what you want to do. You're not being controlled by other entities.
Right.
And that's basically what you're saying. And you're guiding them more in a physiological way to improve themselves. But it's where they have the power. It's within them. It's not, you're not being controlled by outside sources.
Right. That's part of it. Yeah, for sure. Meeting them where they are and really helping them manage any obstacles that they may have, that they may not have even realized until now, so it's really saving space for a patient and not a patient, I'm sorry, a client, and helping them to see how they're thinking and what's resulting from those thoughts.
But now getting on a more personal level with me, since do you find that many of your clients, or that you're getting many older people who have specific physiological problems because of age? I'd say I've been running for 50 years. Mm-hmm. And about 5-6 years ago, my back was hurting. I went to the doctor, spinal stenosis. Why? Because you're running too much. And the bottom of the spine is all cracked up. He said, don't run. So for a few years, I didn't run. Then I went to another doctor who said, you had spinal stenosis, but it's very normal for someone your age. You should continue to run.
Right,
And psychologically, I know I'm much better off running.
Right. So that's where, I feel like as a coach and a physician, they definitely meet sometimes where you have to meet patients and clients where they are. Certainly, there are conditions such as spinal stenosis and arthritis that progress as we age, and certainly can show themselves as we age. But as you said, I'm more in the camp of, when possible, to keep exercising. Again, there are many different factors. You are very different from the next person. So, but certainly if it's safe to keep exercising, it's, as Maxine said in the intro, that there was one quote, that exercise and even just being outdoors it creates a euphoria. I mean, there are so many brain changes that happen with exercise that it is so beneficial, that I would always encourage somebody to do some form of exercise that was safe for them,
right,
over not. Yeah.
And back to your original point, Dr. Solomos, about making this accessible, at least and I'll just speak for myself and my client base, making this accessible to more people. I feel like we intimidate too many, not us in this group right here, but as health practitioners, sometimes it's intimidating for people to start an exercise or even not just exercise, an activity regimen. So the first steps might be just getting outside and going for a walk and getting a decent pair of sneakers. Be low cost, find a place, even if you're in the cities can be very walkable in some cases. So really breaking it down for all levels. So at the other extreme, I've seen, somebody who's got an iWatch who's tracking every bit of activity that they're doing and their VO2 max and all of these high level things. Sure, that's fantastic. But how do we reach the mass of people that are really trying to break in, the entry level exercisers, I would say?
I just got to say a comment on that. Yeah, I mean, I'm using this. I'm using this watch, which I was given as a present for Mother's Day last year, and it keeps tabs on a lot of things because I have to keep tabs on certain things. But from a standpoint of technology, and bringing technology in, because it's not going away, and then the alphas and the Z's and the millennials, they're still, this is, I'm going through the gamut. They're using this stuff, and I don't know, Dr. Solomos, what you see in your practice, or Courtney, what you see with your clients. I mean, the age difference, I don't know if that makes a difference, but hell, at least up here, I see everyone with one of these almost. Yep. So there has to be some joining of technology and medical care and all that. That's why I brought it up, because that's just my point.
Maxine, I do wonder though whether they're using it for, and we've got no idea, right? Because they do a lot of things, right? I mean, some of these are high tech enough. They're running EKGs on some people. I mean, they're very sophisticated. Yeah. But it could be a tool for people just to be checking their email. So are they using it for activity? Are they using it for medical? Or are they using it for email? Like, who knows, right? I mean,
I think a lot of, in my son's age group, he's in his 30s. They're checking their fitness a lot on these watches. And that's why I've also brought it up, because I see it, and then he goes, "Oh, Mom, we can share it so I can see what you're doing," that's when I said no. But anyway, but I see that they are, that's why, in that particular group. And these are young people. We want them, these are the ones that go to the gyms, and they're going back to the gyms now, and these are the ones that are actually being more conscious of their fitness. So that's why I brought it up.
It would be very interesting to see, and I'm sure I'm sure there'll be more data that comes out about this. So if you look at health, the health of individuals from 20 years ago, of individuals before any of this technology was available, compared to, let's flash forward 5 years to decades from now. Like, if it's an unknown right now, right? You would think with this level of sophisticated technology, people would have the edge in terms of health benefits, but I guess that's yet to be seen, right? Like, is there really a difference, or is it just more of a motivator to keep you back? Who knows, right? But it's a good, you're right. It's here and it's not going anywhere.
Yeah, Doctor, the other thing that I wanted to mention, or as I notice as I get older, that the big thing, or an important thing for older generations, flexibility. Mm-hmm. It seems the older I get, the stiffer my muscles get. And it's
that's a physiologic change. As we age, we lose the water content of our soft tissues. And so certainly it makes your muscles and tendon unit less, quote unquote, flexible. And when you're less flexible in that way, you're much more prone to injury. Certainly that's the reason that people start developing shorter stature, because you lose the water content of those discs that sit in between your vertebrae. And so those become thinner and you become shorter. And there are other factors that relate to the spine that help people get shorter as they age as well. But certainly that's a big factor.
Yeah, this is a story I tell when about 6-7 years ago, I had an operation on my knee, and the nurse puts me down and she measures me. She said, "Malcolm, you're 6 foot tall," and I said, "No." She said, "Malcolm, you're 5'10." And I said, "No, you got to do it again. You made a mistake. I'm 6 foot tall." And she lays me down again, measures me. She said, "Malcolm, you used to be 6 foot tall." Apropos to what you said. But does the muscle itself lose elasticity as you get older?
Yeah, it does, because it loses the water content. Yeah.
So is there a way of regaining the water content, or that's not possible?
Yeah, not that I know of. I mean,
you can't hydrate me?
No. Well, hydration is important. I think it certainly helps. And, water, that's all we hear about, but it's true. It's just very good for you. But it's bad news for me because I mean, I'm already short, so.
Me too. If I go any further, it's going to be,
it's bad.
But one thing I know, that the blessing of being a short woman is everyone always takes you for younger than you are.
Oh, yeah.
Yeah.
I'm 22.
You know, it was a bad sign. People used to say 16. Now they're like 35. I'm like, you know.
I can't even reverse my numbers now, so I'm not even going to try. So.
Well, Doctor, you had mentioned, did you mention that you were doing tapes of exercises or things?
I did. I started. I haven't done one in a while, but I was doing videos that I was posting on my Facebook page. I haven't done one in a while, but I have reposted some of those to my personal page because I'm going to be shutting down my Facebook business page. But yeah, I did some exercises and they were really popular. You know, a lot of people liked them. And so, and I even put a couple on TikTok recently. So
is there any way that we could, that you have a website address that we could, our listeners could contact you?
So actually, I do have a website, but I'm going to be changing it soon. Okay. So I'm on Instagram at Nicole Solomos, no spaces or anything. And I'm on Facebook under the same name. So I would say those are the best places right now to find me. And I'm going to be doing a new website soon.
All right, well, you keep us posted on that, and we'd be happy to, send listeners your way. And it's all great, really valuable information. And before we let you go, so if somebody were looking for a health coach or a lifestyle coach, what type of credentials should they look for? I know that there's a national board for health coaches, but maybe some people are kind of flying under the radar and saying they're a health coach, but really aren't. What should they look for?
So this is controversial, I would say. I'm a physician, and being a physician, it's all about your certifications, your board certification, but it's interesting because even for physicians, that's never borne out in how you practice. And, it's just, so there's certainly controversy about certifications, although I'm a physician and I constantly have to take tests to maintain my certification. So, but as far as coaching goes, it is an unregulated industry, but I don't know that that's a bad thing. So I'm certainly, not everybody agrees with me, but there is there is board certification for health and wellness coaches. For life coaching, I believe there might be a certification, but certainly a conflict of interest as it was started by somebody that owns a school. I really believe that if you find somebody that saves space for you and you feel comfortable with, and is not selling you goods or, I mean, obviously they're going to charge you, but it's all about you growing and being comfortable with somebody and them just saving space for you. Yes, I have a certification in health and wellness coaching. I'm going to have certification in 1 week for life coaching. I'm a physician, I'm board certified, but I think that somebody saving space for you is the most important thing. Somebody empowering you by just showing you your brain is super important. So I don't have a strong feeling for somebody being board certified in life coaching or health and wellness coaching. Although the health and wellness coaching, the board certification does exist.
Okay.
Doctor, on that note, we're going to have to say goodbye. Our half hour is up. But it's like the old saying, if they make you feel good, it can't be bad.
Well, yeah, I mean,
as long as they don't charge you or charge you that much, to
whatever you're comfortable with, I mean, it's just.
Well,
And
thank
do
you so
me
much.
one other favor. When you open up your Los Angeles practice, let me know. I'd like to come and see you.
Well, it's all going to be online. You could see me.
You could do it on Zoom. You can do it on Zoom, Malcolm.
Yeah, I think I'll do it.
Yeah.
You
could Zoom
Thank you so
in.
much for joining us, Dr. Solomos. It was great. We'll have to have you back again.
Thank you so much for having me. I would love to be back.
Yeah.
I'll do the wrap. Do
the wrap up.
Okay. Thank you, Dr. Nicole. It was great to have you again. And again, we're going to have you back. And I'm sure I'll be seeing you with my broken up body soon. Thanks for joining us for Courtney on Health. To get more info, follow Courtney on her Facebook page, Courtney on Health, on Instagram at CLG Wellness, and visit her website, CourtneyGravenese.com. For more shows, go to Malcolm.com and theManyShadesOfGreen.com. This is Courtney on Health, Smart Sound Nutrition, Strong Safe Fitness, and we'll catch you again next time.
Bye, guys. Thanks again, Doctor. And Courtney. Bye.
Thanks, guys.